When a large, soft object is forced into a rigid container too small to hold it, physics dictates that the volume has to go somewhere. It spills over into the nearest available exit path. This principle of spatial constraint defines the internal reality of the mouth. The jaw is the rigid container, the tongue is the soft volume, and the throat is the exit. This structural failure occurs when the upper jaw, the maxilla, is narrow. An underdeveloped jaw lacks the physical square footage required to house the tongue. While muscle tone keeps the tongue forward during the day, that support relaxes during sleep. The constrained tongue collapses backward, physically sealing the airway and stopping the flow of oxygen. Obstructive sleep apnea is a localized structural failure, a lack of bone development in the face and jaw that prevents the airway from remaining open naturally. For decades, the standard treatment for this condition has been the CPAP machine, or continuous positive airway pressure. These devices treat the symptom of airway collapse by forcefully pumping a continuous stream of pressurized air past the tongue to keep the patient breathing throughout the night. Pressurized air addresses the immediate need for oxygen, but it leaves the underlying anatomy unchanged. The jaw remains too small, and the tongue remains crowded toward the throat. Managing the symptom keeps a patient alive, but long-term health requires correcting the anatomical deficiency so the airway remains open on its own. Dr. Maryam Seifi is a diplomate of the American Sleep and Breathing Academy. Across her practices at Breath of Life Dental and StarBrite Dental, she focuses on airway-centered dentistry. Her clinical approach is built on the fact that the structure of the mouth, the size of the jaw, the openness of the airway, and the quality of sleep are a single biological system. To treat the root cause of airway obstruction, Dr. Seifi utilizes oral appliance therapy, using systems like the Vivos DNA and mRNA appliances. These appliances are biomimetic, meaning they copy the body's natural developmental signals. This process stimulates the jawbone to resume growing, even in adults. This is guided medical care designed to permanently alter the shape and function of the face. The protocol involves wearing a custom-fitted appliance for a portion of the day and at night, where it rests comfortably against the palate and teeth. The appliance applies gentle, continuous signals to the tissues of the mouth. This pressure prompts dormant bone cells to begin generating new organic bone matrix. Over the course of treatment, the maxilla physically widens, and the upper dental arch expands to its optimal, natural shape. As the upper jaw expands, the lower jaw naturally repositions itself forward to meet it, creating a larger internal cavity. Generating new bone creates the permanent spatial volume needed to house the tongue safely within the jaw, keeping it out of the throat. After treatment, the cross-section shows the tongue resting normally in the expanded jaw, leaving the vertical airway wide and clear. During sleep, this structural change allows a steady, unimpeded flow of oxygen. The body no longer has to gasp or startle itself awake. Clearing the physical obstruction stops chronic snoring and allows the brain to finally reach deep, restorative sleep cycles. Consistent oxygenation leads to systemic improvements, including lower blood pressure, reduced cardiovascular stress, and the removal of daytime fatigue. Restoring the airway allows the body to perform its fundamental tasks of healing and regulation overnight. Because the patient's own body physically builds new bone, the structural results are permanent. Once the anatomical correction is made, the patient can sleep naturally without the burden of machines or lifelong symptom management. Delivering this level of advanced structural treatment is the clinical focus at StarBrite Dental. Correcting these spatial constraints early helps prevent decades of systemic health decline for both adults and growing children. Airway dysfunction is a curable structural deficit. Lifelong health and vitality depend on a fully developed, unobstructed airway.